Welcome to Health Beat, the Bhekisisa Centre for Health Journalism's monthly television program. I'm Mia Malan. It's World AIDS Day, and exactly a year ago, Bhekisisa carried a story about the results of a study into an HIV prevention jab that promised to virtually wipe out someone's chances of contracting the virus through sex. Now we're happy to bring you the latest news on it. We talked to two women who have used both the injection and the daily HIV prevention pill. We speak to the woman at ViiV Healthcare who led the development of the jab. And we find out if the health department will buy the shot and what their budget is. ViiV Healthcare's HIV injection is called CAB-LA. It's being trialled in South Africa to see how easy or difficult it will be to roll out. But will young women, among whom HIV infections are increasing the fastest, use it? Journalists Mohali Moloi and Yolanda Mutseki report from the Western Cape site of the study into this potential game changer.
If you leave the Cape Town CBD via the N2 highway, in about 20 kilometers, you'll get to the township of Nyanga. It was once named South Africa's murder capital. While crime and its accompanying social ills are something Amanda Roberts has learned to live with around here, she's grateful she doesn't have to live with HIV. It took her mother's life in 2016.
Number 2, please come in.
And my mom's twin also has HIV. So I was like, I have to join the study. Because I didn't want to go the same route they had to go.
Amanda is part of a clinical trial which has been going on for the past 5 years.
No, from Eastern Cape. Okay, which part of Eastern Cape?
About 200 women have chosen to get a new injection every 2 months. The shot contains a drug called cabotegravir, or CAB-LA for short. It virtually wipes out their chances of contracting HIV through sex. They get the jab here at the Emavundleni Clinic in a part of Nyanga called Crossroads. For Amanda, the injection has replaced a daily HIV prevention pill she used to take. She struggled to take it regularly.
So some days I'm not at home, I'm having fun. So I don't have my tablets with me. Because I used to be like, hands off, party tablets, I'm driving. That's when the problem started, because I used to skip maybe a day without taking them.
For Boleka Nchinchi, the injection is not only more convenient, it's empowering. This form of HIV prevention is also called PrEP. She says PrEP gives her more control over her life.
But I'm irresponsibility yam yoba nam ndibe because yayazi abafana bazofuna usebenzisa condom. So like I call about upartner wakho kwathina. It's all about you getting irresponsibility uba uzikhathalele.
Studies show the injection works better to prevent HIV infection than the daily pill, likely because it's easier to adhere to. 22-year-old Sinetemba Kolisile says her community needs CAB-LA because of sexual violence.
Like rongo, and then cookie rapes as means like within 1 year cookie rapes like too much rapes, and you don't know ba HIV positive.
Okay,
Steve Innes heads the clinical trial unit at Emavundleni. He says HIV enters the cells in our bodies and makes copies of itself that look just like our DNA.
And that's why HIV can't be cured. Once it's integrated, once it's part of your cells, you can't get rid of it. Cabotegravir is able to prevent the HIV from integrating its DNA into the cell's DNA. In other words, it prevents the cell from becoming infected in the first place.
There were 200,000 new HIV infections in South Africa last year. CAB-LA can help stop this. But while it may be a game changer, it's not coming for free. In the United States, Cab LA sells for 54,000 Rand a pop. ViiV Healthcare, which makes the injection, says they will lower the price for African countries. But they haven't yet announced how much it will cost. Amanda, Boleka and Sinetemba hope their friends and loved ones can one day get the same protection as them from a pandemic that's taken millions of lives.
Professor Becker, the young women in this story say that they hope that their friends and family will be able to get the injection soon too. But that's easier said than done, right?
That's right, Mia. We are going to, as a community, have to learn how to use injectable PrEP in our communities. We've started to differentiate oral PrEP. In other words, we can now think about giving PrEP outside of health facilities. Non-nursing staff can help to hand over the PrEP pills. We've even couriered them in the post to people. And now, of course, with the injectable, again, we need to have a trained healthcare worker. In addition to that, we know that there are some concerns about how we get somebody onto the injectable agents, the kind of testing we have to use.
Let's get back to basics. How does this injection work? Can you explain to us in easy language?
If viewers know about the injectable contraceptive known as DMPA, this is very similar kinds of concept where a bolus of the antiviral is injected into the muscle. And here we're talking about the top part of the buttock muscle, and it sits there for 2 months, during which time it slowly diffuses into the bloodstream and then it works its magic. So it works like any other antiretroviral. It stops HIV replicating. Now, by giving it as pre-exposure prophylaxis, if you like, you've got your prevention on board. Again, a little bit like contraception. You get your contraception on board to stop you getting pregnant. Same here, you have your antiretroviral on board to stop you getting HIV.
Prof, we now know how the injection works, but which group in South Africa needs this jab the most?
We want it to be available to people who find it difficult to take a daily pill. And we know that those individuals might be, for example, young people. Young people we know are challenged to take a pill daily. People whose lives are a little bit, who don't have regular programs in their lives, maybe people who work shifts or people who are moving around a lot. Those are the individuals we imagine may benefit greatly from something that is dosed less frequently.
With the daily HIV prevention pill, we've seen a much slower uptake than what we've expected. So how do we know that there will be a market for the injection and that people will actually use it?
Where I draw the analogy here is in contraception. We know that when we offered women the pill, the injectable, IUDs, implants, women are far more likely to opt the contraceptive method and persist with it. So we think choice is very important for helping people to find a method that works for them and to stick with it. So we're applying that also to HIV. And the question really on all of our minds is, will that enhance the chances that people will, one, find a method that they like and want to adopt, and secondly, that they'll persist with it? Because this has been our other problem with oral PrEP. People have been excited about it. They've taken it up, but then they haven't stuck with it. And clearly the pill only works if it's on board, right? If people are swallowing it and using it.
During the period of the HIV prevention pill, we've obviously made some mistakes during the rollout. So what mistakes can we learn from and correct with the rollout of CAB LA?
Some of the mistakes we've made have included trying to find a particular population, in a way ration the commodity. And so we went down, particular groups of people which stigmatized the intervention. We really want to try and avoid that. We want to make sure this is as normal as possible for people. And then, I think we didn't really work hard at creating demand. Like any new agent, any new thing, particularly for people who are not sick, you need to market that intervention. And I don't think we have really kind of made this something that is desirable to people and something that people feel they can adopt and adapt to their lives and their livelihoods.
We've learned from the COVID pandemic that we can roll out new medicines much quicker than we thought we could do before the pandemic. How long do you think CAB-LA will take to reach South African clinics? What's your dream timeline?
I would hope we are looking at, maximum a year to really get those lessons learned. And even there, we scale up within the pilots and then seamlessly move into getting these into the clinics.
That was Professor Linda Gale-Becker from the Desmond Tutu HIV Foundation and the Desmond Tutu HIV Centre at the University of Cape Town. She's also the chief researcher on one of South Africa's CAB-LA implementation trials. From clinical trials in South Africa to the international company that makes CAB-LA. Dr. Kimberly Smith led the studies at ViiV Healthcare that tested the jab. Dr. Smith, thanks very much for joining us today. Which countries already use the jab?
Well, so CAB-LA for PrEP is currently approved in the United States and in Australia, and it's approved recently in Zimbabwe. It is currently available in the United States. It's not quite yet available in Australia and Zimbabwe.
In Africa, to a large extent, how accessible this jab would be would determine on the price that you would sell it at. And earlier this year, ViiV did say that it will sell the branded product while we wait for generic products at a cheaper price for poorer countries. Have you decided on a price?
What we've said, repeatedly, and that nothing has changed about that, is that we will make it available until there's a generic company that's available to produce it. We will make it available at a not-for-profit price. And so we're doing everything we can, including a number of partnerships, to try to make that price as low as it possibly can be. And so I can't give you a number, but I can tell you that it is a not-for-profit price.
Is there a timeline for how long the negotiations for the price will still take?
Well, it's not so much negotiations for the price. As I mentioned, the goal is to get the price as low as possible. And so some of that depends on volume guarantees and a number of aspects. But I think it's important to remember that, CAB for PrEP is a sterile injectable product. It is a very, very complex manufacturing process. And I think the places where it's been compared to sort of the manufacture cost of a simple white pill are just not realistic.
For you to offer an affordable price, you obviously need to have some sort of guarantee of how many orders you'll get in order to produce it at scale and then to make it cheaper. Do you have an idea of what is the kind of minimum order that you would need to make this viable for you?
Yeah, I can't really give that number yet either. But what I can say is that the partnerships that we have with groups like Bill and Melinda Gates Foundation and SIF and UNAids, those partnerships are critically important for helping us to understand what the demand will be and what the volume requirements will be in the early years, as well as it ramps up over time. And we clearly understand that the volumes will increase over time, and that will allow, for improvements in the price.
If we look at manufacturing capacity, say if you agree on a price tomorrow and you have to start manufacturing at a very large scale, is ViiV able to do that? And how long will that take? And can you do that consistently because you've been manufacturing at a much lower scale up until now?
Well, we have been working with our manufacturing partners in GSK to really do everything possible to maximize our capabilities. And so, we hope that those match the demand, and we'll, again, need to understand more about what the demand will be in the short term. So, in the 23 to 25 timeframe and beyond. And obviously, we expect that will increase. And so we are working very hard to make sure that we can meet the demand.
Do you have an idea of what the maximum capacity it is that you can manufacture, say, annually?
That is changing as we optimize our manufacturing capabilities. And so again, I don't want to commit to a specific amount. I'd like to know, how much, how much folks really see the demand being in the short term.
Has ViiV had discussions with the South African government with regards to price?
So we have submitted to the South African government the product, obviously, for regulatory review, and there are not negotiations with the South African government, as far as I understand at this point.
That was Dr. Kimberly Smith, who led ViiV Healthcare's CAB LA studies. She's also the head of research and development at the company. Back to South Africa. The big questions are, will South Africa be able to afford CAB LA? And is the health department thinking of buying it? Joining us online is the acting head of the health department's HIV directorate, Dr. Tatu Chidarekiri. Doctor, what's the health department's budget? How much can you pay per injection?
So at this point, we are basically going to be depending on what NEMLEC says. The National Medicines, Essential Medicines List is actually going to be putting a price that is generally affordable. For me, at this point, to take out a price would be a bit immature. But we are working towards a price that would be recommended through NEMLEC. That would be right after approval from SAPRA.
ViiV Healthcare hasn't announced the price at which it will sell CAB LA to South Africa, but the price that many scientists and also activists are quoting from discussions with ViiV is £35 per injection, which is about 700 rands, so about 350 rands per month, because you only take the injection once every 2 months. The HIV prevention pill works out to about 60 rands per month. Is 350 rands a month affordable to the health department?
When you procure in bulk, prices tend to decrease. So that's why I'm saying that it's a bit difficult to put out a price now, even if, yes, we have put out communication that says it shouldn't price as much. But we also know that there's going to be a few other factors that would, at the end of the day, influence the pricing.
Have you had any indication from ViiV as to when they would come up with a price?
Negotiations will probably be dependent on how much we are procuring. And maybe we might just influence the landscape in terms of pricing. But as soon as we get the approval, the go-ahead from SAPRA and NEMLEC, we should now be able to have some kind of leverage in terms of supporting or at least negotiating the price.
Now, once that has happened, and if the price is right, how long do you think it will take for the injection to reach clinics in South Africa? So what's the timeline we're looking at?
We are already in discussions, at least at national level with the decision makers in terms of rolling out when, how, and how we're going to do it. And as soon as the price is correct, we finalize in the implementation science. And as soon as that's done, then we update their policy. Once we've got the guidelines in place, it will take more or less 4 to 6 months to get CAB LA to clinics.
If the price is right, what is the size of the order that the health department is considering?
We are still trying to work around that. We are focusing on rolling out to everyone who needs. We always talk about substantial risk as per WHO, but in South Africa, we will be rolling out as per need out there. So we need to work on the numbers, and we need to actually also, as I said, learn from, the rolling out of PrEP, where we started in phases, starting from key populations, moving into the general population, adolescent girls, young women, and we don't really turn anyone back.
Do you know when you would have those numbers and what the size of your first order would be?
All of this is dependent on the first kind of like, I don't want to say donation, but the procurement. You see, it's difficult to make decisions if you don't even have a product. Because once we have the product and then we have the implementation science, then we'll have an idea of the demand.
Dr. Tatu Chidarekiri from the Department of Health telling us that CAB-LA is likely to be rolled out in South Africa on a large scale before the end of 2023. That's it from Healthbeat for December and for this year. In January, we'll be back with news of a project in KwaZulu-Natal that keeps rural doctors from leaving for brighter lights. Have a happy and healthy holiday season.